Stiff person syndrome is a rare neurological disorder which progressively results in a decrease in the efficiency of the nervous system. This is due to decreased inhibitory neurotransmitters within the brain and the spinal cord. While the pathology is not yet fully understood, it's been indicated through various research studies that the condition is a result of an incorrect autoimmune response within the body, in which the antibodies begin attacking the enzyme glutamic acid deoxycarbolase, also known as GAD. GAD is an important protein which works within the neurons to convert glutamate to gamma aminobutyric acid, also known as GABA. GABA is a critical inhibitory neurotransmitter within the body. Its role within the brain and central nervous system is to decrease the action potential of the neurons. When this inhibitory neurotransmitter is not in balance with the excitatory neurotransmitter, norepinephrine, the result is repeated firing of the neurons, specifically within the anterior horn cells. The result of these spontaneous impulses from the motor neurons is repeated stimulation of the skeletal muscles, this being the concurrent muscular spasms which characterize the syndrome. Signs and symptoms. Stiff person syndrome is a progressive disease, meaning symptoms increase in severity over time. This progression period varies and could be over several months or several years. The primary symptoms which characterize this disease include muscle rigidity and recurring spasms. The first of these symptoms to often occur is hypotonia, often referred to as rigidity or stiffness of the muscles. This occurs predominantly within the axial musculature and the lower extremities. With this onset of stiffness, muscular spasms soon begin and progressively increase in intensity until the symptoms reach a peak. The intensity of these spasms can be so severe that cases report patients being ejected from their seats. Furthermore, stiffness can be so severe in some cases, patients are unable to walk and require a wheelchair. These primary symptoms have been found to heighten in severity during times of psychological distress. Examples of triggers for patients include periods of anxiety, exposure to sudden noises, sudden touch, and sudden movements. Due to the severity of these symptoms, secondary symptoms arise within all cases of stiff person syndrome. An example being the force produced from the muscular spasms, resulting in bone fractures and soft tissue damage. Most commonly, postural abnormalities can be observed within various areas of the body, in which the syndrome is most prevalent. Within many cases, this is often the spinal column and lower extremities. Within the spinal column, often a decreased range of motion in conjunction with hyperlordosis or kyphosis is observed across a range of clients. While typically within the lower extremities, secondary symptoms often involve the development of claw toes, plantar flexion contractures, and impaired range of motion due to hard and soft tissue damage. Effects on movement control. The resulting gait is often altered significantly to compensate for the range of secondary symptoms and reduced function of the joints within the lower extremities. This altered movement pattern is typically wide, rigid, and slowly executed, with a heavy emphasis on maintaining balance. It's been described to be similar to that of a tin soldier. An individual suffering from stiff person syndrome suffers from rigid lower extremities, and for this reason they are highly susceptible to falls. It has been reported that up to 65% of patients cannot complete daily activities successfully. Treatments and interventions. While there is no cure for this condition, there is a range of treatments which have been proven to decrease the intensity of symptoms and slow down the progression of the syndrome. Current medications include antispasticity drugs and GABA enhancers. Antispasticity drugs are used in the early stages of treatment. They work by slowing down the nervous system and in doing so alleviating anxiety, which acts as a trigger for spasms, and also relieving the muscle spasms themselves. In more severe cases, GABA enhancers are used to boost the GABA count within the central nervous system and reduce spasms. These are still relatively new and side effects are not fully understood. In conjunction with the medical treatments mentioned above, physical activity such as physical therapy and occupational therapy are recommended. Many studies state that it improves range of motion to affected joints, improves one's posture, and decreases the pain resulting when spasms aren't present.